Good morning, ladies and gentlemen, and also PhD students, candidates, supervisors, committee members, family members, friends. Welcome at the 8th Progress Report. And also, first I would like to congratulate the candidates that you have reached this point. So far you had 7 progress reports. The last one was the institutional local defense, the internal defense, and now you got this point, and then now you can present your work that you have done so far. First I would like to introduce myself. I'm Rita Nagy. I'm working at the Center for Translational Medicine as a senior lecturer, and I'm one of the vice directors in the system. Before the introduction of the committee members, I would like to briefly summarize the concept of the translational medicine, which means how we can transfer and incorporate the scientific results into the daily healthcare and how we can give them to the society level. So the vision is science into the healthcare, but how can we achieve this vision? So for that we need to act and having missions. So we need to alter the medical education and medical training. So just getting back to the history, it was already initiated, this two-way model, so bench to the bedside and bedside to the bench, already in the 90s. However, it was not efficient enough. The process itself, maybe just because of the lack of the communication between the healthcare providers and the basic scientists, but altogether it was not sufficient enough. And then there was another developed system with different domains, but still the process how we could incorporate the scientific results into the daily healthcare, still it was not optimal. And there is a newly developed translational medicine cycle, and in this work also the members of Academia Europaea were involved, and this whole concept has been published in 2020. So the point is that the bigger winners will be the patients, so the main aim is to achieve the healthcare benefits for them. So just one example, and again going back to the middle of 19th century to Vienna. So there was a trainee, a gynecologist trainee, who observed that between the two maternity units, between two obstetrical clinics, there is a significant difference in the mortality of the moms. So first he started investigating what can be the reason why the maternity mortality rate is significantly higher in one of the units. And then he realized that the physicians usually come directly from the autopsy room, and then without any hand washing, they examine the women. So he initiated the regular hand washing before the examination, and within 1 year, the mortality, the maternal mortality, dropped from 11% to below 1%. And this man was Ignaz Semmelweis. But of course, there are recent results as well. For example, one example from the St. George County Hospital from Székesfehér, where one of the PhD fellow investigated the antibiotic usage in acute pancreatitis, and they realized that there is a huge excessive and in some of the cases unnecessary antibiotic usage in acute pancreatitis, which is not an infectious disease. And after these findings, this was implemented in the daily healthcare. And again, within a short period, the antibiotic usage dropped significantly, and still the patient safety part was at the same level. It was not worse, and also the length of hospitalization decreased significantly. And another example now from the ENT field, from the Bajcsy Zsilinszky Hospital, the team was investigated the best technique how to minimize the recurrence of the cholesteatoma. And first they conducted a meta-analysis. They found the best method for that, and they immediately started using this kind of procedure in their daily practice, and they already published these new results. And about the concept, in the past few years, there were several publications about the educational concept. For example, the system education, where the high school education is also included, and also the translational medicine cycle concept. And the newest publication, which is about the interpretation of the scientific findings, it's the so-called ring diagram. So whether both the safety, the effectiveness, and the cost effectiveness part will match. If every part will get the green light, then of course it can be and it should be immediately incorporated in the daily healthcare. So let's see our numbers very briefly. So in the past few years, we started the academic year with approximately 90 students, and from this year we have MSc students also from Vienna. And we can achieve not only high number of students each year, but also we could have very nice publications in the leading journals from JAMA to GUT, for example. And also the scientometric parameters, which of course it's a debated thing whether it reflects the scientific activity the most, but probably if we take just as a system, it can visualize very well that for example, the average impact factor, based on our publication, it's around 5, and also the cumulative impact factor, it's already reached the 2000. And also, those who participate in this program, the students have the opportunity to meet either Nobel laureates or very distinguished lecturers here. And also here you can see the upcoming dates for these lectures. And this is a short video about this translational medicine concept and about the education itself, and then I will continue.
Science is an indispensable element of progress and the future. Science changes lives when discovery leads to action. The National Academy of Scientist Education makes this happen through 2 programs: the Discovery Science Program, which focuses on nurturing future researchers, and the Translational Science Program, which turns knowledge into real-world applications.
I think the development is fantastic. When I came first time, it was a program centered in Szeged, you know, with students coming from different parts of Hungary. But meanwhile, the program has developed into 2 branches, you know, and actually one of these branches aims at revolutionizing science education in all of Hungary.
I don't think you can be a good physician today without understanding science, without doing science at some time in your life, asking questions, critical questions, analyzing the literature.
The Translational Medicine Hybrid PhD program, launched in 2016, aims to provide healthcare professionals with the knowledge essential to translate scientific results to their patients' benefits. Since 2019, 50 students, including doctors, dietitians, psychologists, and economists, have defended their PhD theses as part of the program. To date, more than 350 PhD students and 200 mentors from 24 countries have joined the international program. Recently, the program has accelerated significantly with the support of Semmelweis University, the government of Hungary, and Academia Europaea. Healthcare professionals have been able to demonstrably improve the quality of patient care in a short time, which, in addition to its positive social impact, has also resulted in cost-effective patient care.
If they choose to develop career in science, they will have the view of the entire distance between the patient bed and the route to try and cure and help and develop drugs like we do.
Besides the several professional and social events, students of secondary schools and universities, as well as healthcare professionals, can attend the meetings of Nobel laureates and talented students, which are organized by the Academy twice a year. At the conferences, approximately 2,000 guests, pupils, students, mentors, doctors, and other faculty members can listen to scientific presentations of professional quality, participate in educational events, and meet or talk to Nobel Prize-winning scientists and internationally renowned researchers. Since the first meeting in 2012, the Academy has held 24 successful conferences, with the prestigious participation of 18 Nobel laureates hailing from different parts of the world.
First of all, I have a tremendous admiration and inspiration by what is done here to this program. This program is unique around the world. It's very special. It's not only going to improve Hungary, it's going to improve not only Central Europe, it's going to be a motor for progress, innovation, and a better world around the world.
The capital that you are building through this program, human capital, social capital, and potential economic capital, this is a great investment, and I really think that every country should have programs like this, and I think that you should invest as much as you can afford it.
Peter Higi convinced me that it's a good idea to train young people of the area of Szeged, and knowing Peter Higi, I know that he's a very hard worker, very enthusiastic, and I just got infected by his enthusiasm. All I can say is I'm very impressed, and I hope it continues like this.
Thank you.